From DLA Piper, this is the Beyond the Curve podcast. What would a renewed U.S.-Africa economic partnership look like? And what opportunities can be created for the U.S. private sector? Dana Banks, Special Assistant to the President and Special Advisor for the U.S.-Africa Leaders Summit. Angela Wasunna, Vice President of Global Policy and Public Affairs and Emerging Markets at Pfizer. And DLA Piper's Edward Smitty Smith discuss.
Hello and welcome to DLA Piper's Beyond the Curve podcast. My name is Edward Smitty Smith, and I am chair of DLA Piper's Regulatory and Government Affairs Practice Group. For our conversation today, I am particularly excited to welcome two very special guests with deep experience in Africa, foreign policy, business, and development, Dana L. Banks and Angela Wasunna. Dana is the Special Assistant to the President of the United States and Special Advisor for the Africa Leaders Summit of the National Security Council. She's had an incredible career and came to the White House after 23 years in the State Department, serving as Deputy Political Counselor at the U.S. Embassy in South Africa, Deputy Chief of Mission at the U.S. Embassy in Togo, and Public Affairs Officer in Tanzania. She was also Special Assistant to the Assistant Secretary for Africa. Thank you very much for joining us, Dana.
Thank you.
Angela is Vice President of Emerging Markets Policy at Pfizer. Her policy portfolio stretches across a range of areas, including drug pricing, intellectual property, health systems, healthcare financing, and regulatory reform in emerging markets. She has a deep range of experience, including work with the World Health Organization, the Institute of Medicine, the Centers for Disease Control, the Gates Foundation, and the World Bank. And I would be remiss if I didn't mention that Pfizer is a client and also, as a company, sits on the President's Advisory Council on Doing Business in Africa. Thank you both for joining us today. I think we're going to have a unique opportunity to learn from the two of you, and it's a real honor to have such eminent experts with us. So we're at a very exciting time in the relationship between the U.S. and African nations, and you're both experts on both the continent and key areas of interest in the U.S.-Africa relationships. So my hope is that we can have this conversation be free-flowing and open, but I do have a few questions that can hopefully catalyze the discussion and get us going. I'd like to start with Dana. So Dana, the Biden-Harris administration recently released the long-awaited U.S. policy towards Africa in August. And that release capped a very active year by Secretary of State Blinken. And he really was on a whirlwind tour around Africa between November of last year and this year. And in looking at the policy towards Africa, it seemed to recognize Africa's prominent and increasing place in the global marketplace in geopolitics and focused on a number of key issues, particularly around Africa's growing population and the creation of the world's largest trading bloc and significant resource endowment that Africa possesses, and really hit on a number of key objectives: fostering openness and open societies, delivering democratic security dividends, advancing pandemic recovery and economic opportunities, and supporting conservation and climate adaptation and energy transition. It's a lot. So Dana, would you say there's been some sort of paradigm shift in the U.S.-Africa policy?
Really a pleasure to be here, and thank you for that question. I think that what you have seen from this administration from the outset with President Biden's remarks to the African Union Summit in February 2021, up to and including the release of the strategy towards sub-Saharan Africa this year by Secretary Blinken, and as well as his travel in November 2021, where he gave the first major policy speech on Africa. I think that there is a through line that will culminate in the summit, but really does signal the intention and the vision of the president, of this administration, on how we will engage with the continent. And that is engaging as partners. How do we partner with the continent, with African leaders, with African diaspora, with the youth, with civil society, with all of the stakeholders who really are engaged in creating the Africa of the next generation? How do we then, as the United States, take our partnership that we have been cultivating over many years and really elevate it to the next level, to a true 21st century partnership, particularly as we look to address some of these global challenges, whether it's in health or in climate, addressing climate change and mitigating the impacts, as well as transitioning climate adaptation, or in how we address health security threats, how we address food security challenges and peace and security challenges, to be sure, but really also how do we harness the opportunities that abound between the U.S. and the continent to really drive not only greater trade investment, but two-way economic growth. So that's really what you have seen from the very highest levels of the government and throughout the U.S. government interagency and our engagement with the continent. And surely we are indeed very excited for the president hosting the Leader Summit this December to really bring all of that and put it onto display as we engage, as he engages with his counterparts from across the continent, and as we, as the rest of the government and the cabinet and the interagency, really have those discussions more broadly and fulsomely. So we're really excited about not only the summit, but what this will mark in terms of elevating our partnership with the continent.
Wonderful. Thank you, Dana. I guess it's safe to say that Africa really is a core priority for U.S. foreign policy right now. So I'd like to ask you, Angela, we've heard a little bit about the perspective from the government side. And at Pfizer, obviously, you have a portfolio that is very broad and is particularly looking at emerging markets in Africa. How do you see things with this new U.S. policy affecting Pfizer and Pfizer's business or the private sector generally?
Thank you, Smitty. And on behalf of Pfizer, first, let me just also thank you for inviting me to join this really important conversation. So yes, we think this new U.S. policy demonstrates a pivot in how Africa is perceived. So I was at the inaugural Global Africa Business Initiative during this year's UN General Assembly in New York. And this event brought the best and the brightest political, business, and civil society leaders from Africa and the world. And to me, it was very clear from the conversations that this is a continent on the move. It cannot be ignored by the US and other dominant global players. And in fact, the stats speak for themselves. I mean, Africa has a population of 1.3 billion people. It's now positioned to be the most important driver of global business with a $2.5 trillion market opportunity. And every sector on the continent is growing, right? From manufacturing to agriculture to services to finance. And for the sector that I work in, healthcare, the UN has estimated that the opportunities for business in health in African Union countries will be worth nearly $260 billion by 2030. And then moreover, and Dana alluded to this, by 2050, 1 in every 4 people in the world will be African. I mean, just think about that for a minute, that Africa will constitute 25% of the world's population in less than 30 years. The population is young, it's innovative, it's vibrant, it's increasingly connected to the rest of the world. And as Dana said, I mean, the diaspora community is making significant contributions to their home countries. Here in the US, they're super successful, bringing their world-class education and skills back to the continent. So this UNGA event that I mentioned was called Unstoppable Africa. And I think that really describes the continent and the moment. So to your question, I think the US strategy comes at a critical time when greater partnership, equal partnership between the US and African countries and institutions is really much needed. And as acknowledged in the policy itself, the Chinese in particular have made some significant inroads in nearly every sector of the African economy. The US needs to engage in meaningful and sustainable ways. You asked about Pfizer in particular. So we've been on the continent for about 70 years, and our products reach every African market. So we have about 140 private sector business partners in Africa, over 400 employees on the continent. And in other words, I guess we consider ourselves to be true African citizens, and we are vested in its success. So we welcome the opportunity to work with Dana and the administration on 4 key areas I'm sure we'll talk more about. And these are pandemic preparedness, increasing partnerships with the private sector on health, increasing capacity building efforts, and increasing trade and investment. But overall, we see this as a very positive pivot, and we're here to provide all the support that we can.
Wonderful. Thank you very much, Angela. Some of the points that you touched on and just some of the statistics are really stunning. The growth of population in Africa. And I've seen a lot about how big of a market Africa is today, but stands to be in the future. If we're talking about a continent that will represent a quarter of the world's population by 2050, that's a tremendous opportunity from a development standpoint and from a business standpoint. I saw a statistic that laid out that Africa would be home to something around $16 trillion of combined consumer and business spending. So this is huge. And it's, as a trade partner with the U.S., it's been on a rapid climb. So I'm curious, where do we see some more opportunities for the U.S. private sector there in Africa? But perhaps you could talk a little bit more about opportunities for the private sector that you see from the State Department's perspective.
I can jump in first. So from Pfizer's perspective, well, first of all, we found it really interesting that the new strategy doesn't necessarily call for creating big new economic initiatives, at least from our read. Instead, it seeks to make the existing ones, Prosper Africa, Power Africa, more effective. And we think this is a really important step that could have a substantial impact because these are broad initiatives that cover a lot of ground on the continent. However, we think that much more is needed to be done to improve trade relationships in particular and create investment opportunities for U.S. companies. Now, we know that trade negotiations can be long and challenging, but the absence of any major U.S. trade agreement with African countries is a missed opportunity. Growing trade across the continent, we think, is critical to creating resilient, healthy economies. So that's why we think this is the time to start planning and implementing a really comprehensive, longer-term U.S.-Africa trade and investment strategy. The private sector can play an essential role in helping the administration advance its strategy in this respect. And the upcoming Africa Leaders Summit is a great opportunity to build the mechanisms for private sector engagement. And let me just give you a couple of examples of how we think this can be done. We think that establishing a formal annual high-level dialogue with an official private sector mechanism with Africa to help advance priorities and establish a pull-through mechanism would be key. We also think creating a formal mechanism for the U.S. private sector to provide input and engagement with the African Continental Free Trade Area and other bilateral arrangements, such as the ongoing U.S.-Kenya Strategic Trade and Investment Partnership, is critical. So in other words, really creating those formal channels where the private sector can engage in a meaningful way in these discussions between African countries and the U.S. government.
Wonderful. Thank you, Angela. We've seen that healthcare is a major part of the strategy, and obviously it's a major focus for Pfizer. And with Africa, I think, representing 16% of the world population, but really carrying about 23% of global disease burden, and yet only 1% of global health spending. What are we seeing now in health in Africa, and particularly coming out of the pandemic? What can we expect from companies like Pfizer to strengthen health infrastructure in Africa in all sorts of areas, but particularly in vaccine inequity? We saw that throughout the course of the pandemic.
Yeah, thank you for that question. And, we played a pretty big role in rolling out our vaccine across the continent. So, look, we know that in many parts of the world, the pandemic has disrupted Africa's supply chains. It's increased the burden on its healthcare workforce. And this just makes it more difficult to provide care, not just for infectious disease, but also for chronic diseases, which are on the rise on the continent. Some of the things we learned during our experience is that pandemic preparedness requires bold political leadership. It requires sustained investment and risk-taking in R&D, in research and development, like we did. You need to have resilient health systems. There has to be a free flow of treatment and equipment across borders. You also need to have strong manufacturing and supply chain infrastructure, and then sustained and active collaboration across sectors. So we learned a great deal about delivering vaccines, to your question, to low and low middle income countries quickly, and in partnership with critical stakeholders like the US government, COVAX, the World Health Organization, UNICEF, and others. In fact, as of early this month, we've shipped more than 3.8 billion COVID-19 vaccines to 180 countries. But part of our experience with this pandemic really demonstrated the equity gap. And it led us to develop an initiative which we announced this year in May called An Accord for a Healthier World. So this is a commitment that's aimed at really trying to reduce health inequalities that exist between lower income countries and the remainder of the world. And it's a bold goal, which is to ensure that these countries can receive the highest quality, safest, and most effective healthcare solutions at the same time as patients in Europe and the US. So our CEO made this pledge to provide on a not-for-profit basis all of our patent-protected medicines and vaccines that are currently in the US and the EU to all lower-income countries, as well as countries that have graduated from lower-income status to lower middle-income status in the last 10 years. And this pledge includes not just our current innovative medicines, but our future pipeline. Again, this is really a nod to trying to do something about this inequality health gap that we're talking about. So through this program, 45 countries will be able to access our products. And we are proud that the African continent will be the biggest beneficiary, with 33 of the 45 countries being in Africa. And we're in active negotiations with, right now, nearly 30 countries in Africa. Through this initiative, we already have product in Rwanda. We anticipate products being received in other African countries before the end of the year. And it's not just a Pfizer initiative. It really is a call to action, because we know this sort of program requires a lot more in terms of building of health infrastructure and the ecosystem, providing training, capacity building. So we're in negotiations with a number of NGOs and also peer companies, quite frankly, to join us and really work together towards this goal. There are significant hurdles, as I said, to getting products to patients quickly. And this is also where, Dana, the US government and African governments that are enrolled in this program, we feel that we can work together to identify solutions that address these key barriers that prevent access to innovative medicines and vaccines. So a lot of lessons from the pandemic, but we think this is a really strong initiative that hopefully will help us to move much closer to a world where health inequality, the gap, is much narrower.
Wonderful. Thank you, Angela. And Dana, we saw replete examples of how the U.S. government could have a major impact in partnering with the private sector in helping to address issues of health inequity and mobilizing resources quickly through the pandemic in order to make sure that we were able to best leverage our resources, best leverage both public and private resources in the interest of supporting health needs both in the U.S. and abroad. And I think I saw recently that the DFC, the International Development Finance Corporation, had just dispersed a loan to a healthcare network in East Africa, actually to a point that Angela just raised, looking beyond just some of the more traditional communicable diseases, but actually looking at the changing healthcare demands that we see in Africa to address things like dialysis centers and increasing populations with diabetes. So there's a constant sharing and interaction between public and private. And from your perspective, what are you seeing some of the initiatives that are underway and that are on the way to address healthcare needs on the continent?
Thank you for that question. Most certainly, we definitely see that partnership and collaboration with the private sector is key. And I think Angela touched on this a little bit ago when she talked about the Prosper Africa initiative, which really is about harnessing the power of the U.S. government departments and agencies, 17 in total, who are implicated in this mission to really increase not only trade investment, but partnerships with the private sector to address some of these global challenges, particularly, I guess, as we're discussing in health in this case, but through a range of other key sectors, particularly when we talk about infrastructure. And this is the type of mutually beneficial relationship and partnership that President Biden had laid out at the beginning of this administration when he was talking about our engagement on the continent. The Prosper Africa, certainly, and the relaunch of that is one where we do a lot of engagement and partnering with the private sector to really meet some of these challenges. And I think as we have conversations with the private sector, there is the PAC-DBIA, the President's Advisory Council on Doing Business in Africa, a group that consults and submits recommendations on how to actually facilitate American companies doing business in Africa better, where are the improvements and challenges. So those types of conversations that can help inform on the policy side, I think, are critical as we look at building out and strengthening relationships with the private sector in the future.
Wonderful. Thank you. And both of you have mentioned, I believe, the African Continental Free Trade Agreement. So as we talk about partnership between the U.S. government and the private sector in Africa, I'm curious, Dana, going back to you. Here in the U.S., we are Africa's second largest trading partner. What are the U.S. government's views on the Free Trade Area Agreement and what it can do to increase the market in Africa for U.S. companies?
So with the African Continental Free Trade Area, we were really excited to see that the continent has really set out a vision and the goals for how they want to engage not only amongst itself, amongst countries on the continent, and regulate some of that trade and normalize standards to facilitate increased trade, but also how they want to engage as a free trade area with the rest of the world, of course, and with the United States in particular. So this is something we are excited about, we are interested in supporting, and we want to know how we can best support it for the benefit of not only our African partners, but certainly for the United States and our investors and our private sector. So we are having conversations with the Secretary General of the AFCFTA, and we definitely look to continue those conversations and have this as a point of discussion. How can we really solidify our support to the AFCFTA, but also how we can best position ourselves and our private sector to engage through the AFCFTA, understanding the regulations, helping African companies as well, understanding better the U.S. regulations and the market to really take the trade investment relationship with this huge, the second largest it will be in the world once fully ratified, with the continent to the next level.
Excellent. Thank you, Dana. And Angela, with respect to the free trade area agreement, how do you see it impacting pharmaceuticals, Pfizer's industry, and particularly with respect to Pfizer, you all have a newly launched initiative, the Accord for a Healthier World. Where do you see that fitting in with this soon-to-be second largest free trade area?
Yes, I mean, like Dana, we're really excited about it. I agree with everything she said about its potential. We think that an agreement like this obviously will foster greater collaboration with the USG and the private sector. And we think it has the potential to address systemic challenges that companies like ours have faced when doing business on the continent. And maybe just to highlight two challenges that are related to the accord that I mentioned, the Accord for a Healthier World, but also our business in general in Africa, because we do have a thriving business on the continent, right? And Dana mentioned a little bit on this, which is the need for more regulatory harmonization and securing of supply chains. So for industries like ours to unlock the continent's potential, we really need to have more open borders and the elimination of tariffs. We also need to create economies of scale that will allow us to invest more, and this leads to better health outcomes. So specifically, we need to have across the continent, ideally rather, harmonization of regulatory standards for the approval of medicines, for labeling, and export to create a single market. The establishment of the African Medicines Agency, which is now headquartered in Rwanda, is a great first step. And of course, we stand ready to work with the African Union to strengthen regulatory systems and regional regulatory harmonization. And here, again, is where we think the USG can play a leading role, a leadership role in standing up that organization and bringing those best practices that we know will serve the continent well. The second challenge that we face on the continent, which again, we think that this trade agreement will be extremely helpful in, is countering illicit trade in pharmaceutical products. So the impact of illicit trade is far-reaching. It undermines the achievement of longer-term socioeconomic goals, and it also poses immediate threats to the health and well-being of African patients. So improving trade standards across the continent can directly and indirectly curb and mitigate illicit trade by creating stronger customs, regulatory, intellectual property, and law enforcement policies. So there's a lot of promise with the free trade agreement in having a single marketplace for our products. And we look forward to working with the US government and African governments and the African Medicines Agency to make this a success.
Thank you. So one more question that touches on an event that's coming middle of December. You both have mentioned the African Leaders Summit that will be here in Washington, D.C., which I'm particularly excited about, being in D.C. and being a D.C. native, to be able to host such an event. Hopefully you get to see each other. And as you both come to this event, what would success look like to you? What are you hoping to see come out of the event, both for the government, but also individually? So I'll start with Dana.
This is really an exciting moment from when the president stated his intention last November 2021 to hold the summit this year, to when Vice President Harris announced the official dates in July of this year at the U.S.-Africa Business Summit and a videotape message in Marrakesh. We really have been behind the scenes doing a lot of work, a lot of collaborating, a lot of listening to various partners donors to stakeholders to most assuredly our African partners and governments, but also the stakeholders involved, the private sector and the young leaders on the continent, really with a wide range of stakeholders to make sure that this conversation that the president will host with his counterparts from the continent will really reflect the depth and the breadth of the relationship. And as I mentioned earlier, where we would like to take the relationship to the next level. And particularly, we anticipate that the agenda that is laid out will be a reflection of the voices that we've heard throughout this entire process of planning and collaborating on organizing the president's vision for this summit with our African partners. So we're very excited. I think as these events are, they're definitely a forcing function for conversations, for connections on the business side, as well as on the policy side. So I think I'm sure we'll catch each other at some point around the streets of DC, which will probably be a little heavy with 50 African heads of state in town, but it's sure to be a wonderful engagement.
Terrific. Well, I do hope that we get to see each other. Sounds like you're going to be very busy, but I'm going to try to carve out a little bit of your time if you can. And Angela, how about you? Will you be here? What do you think? What are your plans?
Listen, Smitty, DC will be the place to be from December the 13th to the 15th. So I'll be there and I will look out for both of you for sure. I'm sure I'll see Dana. Look, as an African working in a U.S. company, I'm super proud that these conversations will be happening. And it's significant, right? Because the last time the USG hosted this event was 2014. So as Pfizer, we're super excited to work with Dana and the administration on the summit itself, as well as the business forum. And we really want to explore ways that we can work together to leverage the summit, not just to support the Accord for a Healthier World that I spoke of, but really our total footprint on the continent. And Dana, if you allow me, just have two ideas of how we might do that. So first of all, we hope that the White House will replicate several of the best practices from the summit in 2014. And these included things like including the private sector in the state dinner, hosting salon-style dinners around town with the administration officials, African leaders, and the private sector, NGOs, etc. And then secondly, we think it's important to ensure that the summit produces meaningful results that enable concrete progress on priorities beyond the summit itself, so that the private sector can be really seen as a true partner to the administration as it continues to advance its priorities in Africa. And this could be simple things, right? Like an annual high-level dialogue with Africa, but with a formal role for the private sector. For our sector in particular, having a regulatory cooperation dialogue with the African Union with a formal role, again, for the private sector would be game-changing for us. Also having an interagency task force to develop capacity building mechanisms to prevent, as I mentioned, illicit trade on the continent, we think would go a long way in enhancing the delivery of healthcare in Africa. And lastly, we think that the private sector is a key partner in helping the administration implement its priorities for the continent. And the Leaders Summit, it creates a significant opportunity for us to come together to really just share ideas on how we can work together. So we look forward to the event. We look forward to the engagement through those busy 3 days. And you can count on Pfizer's support to advance our shared priorities.
Wonderful. Thank you. This has been incredibly interesting and educational for me, to be honest. And I've loved this opportunity to talk with you both. And if there's things that you think are really important from the administration's perspective or from the private sector perspective that you'd like to share, I would love to talk about it a little bit more or hear about it.
I'll just start by saying thank you again for hosting this. This has really been a wonderful conversation. And just to reiterate that I think in terms of the U.S. and our commitment to the continent, particularly in addressing some of the most pressing challenges that we all face globally, is rock solid. And we do think that while the upcoming Leader Summit is an exciting manifestation of that, it's by no means the end of the discussion or the engagement. So we really are excited for this moment and the energy, I think Angela mentioned earlier, that has been spawned by the Leader Summit, but also by this re-elevated focus on our U.S.-Africa relationship and all of the stakeholders who are involved and play a role in that. So thank you for allowing me to come today to talk about that and to have this engagement, Angela, and to hear some of the perspectives from the private sector, particularly in the health space, as we move forward to address challenges. Thank you.
Terrific. Thank you, Dana. Angela?
Yes, like I said earlier in our conversation, we cannot ignore Africa. This is a huge business opportunity. There is a lot of potential on the continent that US companies really have to be in the game. And to the extent that the US government can help create that enabling environment for US companies to thrive on the continent, because if we don't do it, others will take our place. So I guess my call is really just for us to have this sustained conversation with African leaders, that this not be another one-off event, that we don't have to wait for years before the next summit, right, Dana? And that we continue to engage in a way that demonstrates that we see Africa as an equal partner. And as I said, companies like Pfizer, who've been on the continent for many, many years, we are vested in the success. When Africa succeeds, so do we, and so do all our colleagues who live and work and thrive on the continent. So thank you again for inviting Pfizer, myself, to bring our perspective to this conversation. And we look forward to continuing it in December.
Excellent. I look forward to seeing you both here. And with that, that's the end of our episode today. Another of DLA Piper's Beyond the Curve podcast. Thank you for joining us and looking forward to our next discussion.
Thank you for listening to DLA Piper's Beyond the Curve podcast. All information, content, and materials contained in this podcast are for general informational purposes only. This podcast is intended to be a general overview of the subjects discussed and does not create a lawyer-client relationship. Statements and opinions are those of the individual speakers and participants and do not necessarily reflect the policies or opinions of DLA Piper LLP US. The information contained in this podcast is not and should not be used as a substitute for legal advice. No listener should act or refrain from acting with respect to any particular legal matter on the basis of this podcast without first seeking legal advice from counsel in the relevant jurisdiction. This podcast may qualify as lawyer advertising, requiring notice in some jurisdictions. Prior results do not guarantee a similar outcome. DLA Piper LLP US accepts no responsibility for any actions taken or not taken as a result of this podcast.